Well, good morning. I'm speaking today on the traditional territory of Treaty 6, and I acknowledge the Métis people who share a deep connection to this land. Today, the UCP has pushed our public health care system in Alberta into even deeper chaos. Their decision to fire Dr. Verna Yiu comes at a critical time for our province and for public health care in general. Dr. Yiu has served Alberta as the head of AHS for 6 years, including some of the most difficult years in the history of our province. She has capably managed Alberta's hospital system through a pandemic, while the UCP did everything in their power to make the situation worse. Albertans have seen the candor that she brought to COVID-19 briefings, a willingness to tell the truth that we certainly did not get from our ministers of health, Tyler Shandro or Jason Copping. And now, Dr. Yiu, of course, is a consummate professional. And I think that's reflected in the comments that she released publicly this morning concerning her departure. But I can't help but wonder if Dr. Yiu's habit of giving Albertans the straight goods is part of, if not the chief reason, the UCP has fired her. She's been targeted by the extremist factions within the UCP, MLAs who opposed even the most basic public health measures and who believe the hospital system should have endless capacity to deal with the runaway spread of COVID throughout the province. UCP MLA Dan Williams said in the legislature, and I quote, "AHS leadership has held a knife to the throat every day for 91 days of many of my remote communities by not implementing any Plan B." Those were and remain disgusting comments from Williams, but he's faced no consequences. Nobody in the UCP has criticized him. UCP MLA Shane Getson blamed Dr. Yiu for the government's catastrophic failures in the fourth wave, attacking her salary and saying, "For this kind of money and the amount we pour into the system, I think we need to be getting more bang for our buck." He even went so far as to accuse her of not properly staffing ICU beds. These same extremists within the UCP caucus and out also oppose the requirement for AHS workers to be vaccinated against a virus that has killed more than 4,000 Albertans. It's a common sense clinical precaution. But Jason Copping reached into AHS personally to undo it. At the time the mandate was removed, Dr. Yiu made it clear that she had been directed to do so by the UCP government. It's clear to me that Dr. Yiu put the health and well-being of Albertans first during an unprecedented public health crisis. Apparently under the UCP, that's a fireable offense. Think about that. Multiple UCP MLAs, indeed even ministers who actively undermined and undid public health measures, have faced no consequence for their actions. But Dr. Yiu is being fired for fighting to protect public health. For months, the UCP has focused on their own political fortunes, on saving Jason Kenney's job, and doing so by appeasing a group of extremists who wanted to spread misinformation and conspiracies about COVID-19. Now our healthcare system is pushed into disarray with no replacement CEO in place. Why is this being done now? Particularly given the concerning increase in COVID infection shown in wastewater data. It's hard to forget that UCP members will begin voting on Jason Kenney's leadership very shortly. The dismissal of Dr. Yiu is an attempt to appease the extremists within the UCP and tempt them back into Jason Kenney's camp. And I'm deeply concerned about who this government will look to now to fill the critical role of AHS CEO, particularly that as we know, they are fully intent on forcing more American-style private profit into our public health care system. The pandemic only served as a roadblock to their plans, not a permanent barrier. They're quite happy now to get back to them. And we know this government continues to lay off frontline healthcare workers, threatening to cut their pay and benefits whenever they get the chance. All of this amounts to chaos in our public healthcare system at a time when we can least afford it. Now, before I take your questions, I want to take a moment to say this. To Dr. Verna Yiu, on behalf of our caucus, we thank you. You have served Albertans well through good times and bad. You guided our hospital system through waves of COVID that were far worse than they had to be due to the failures and the deliberate decisions of this UCP government. You deserve far better than the ugly treatment you've received from this failed government. to frontline healthcare workers. This is a willful and deliberate effort to destabilize Alberta's public healthcare system. I'm sorry for the message this government is sending to you, that they view those who stand up for public health in this province as disposable. You deserve better than this as well. And please know that Alberta's NDP stands ready to deliver better for you. And to Albertans, this once again makes clear we simply can't trust the UCP with healthcare or with anything else for that matter. This is a move towards chaos and instability in our healthcare system at a moment that demands stability and strong, principled leadership. Unfortunately, this kind of political manipulation, this kind of chaos and uncertainty, it seems it will continue as long as the UCP remains in power. Today's news underscores that if we want to take a different path, where we strengthen and invest in public health care, we're going to need to elect a different government. Thank you, and I'm happy to take your questions.
All right, we have a full house of reporters here today. We're going to start in the room. We'll start with a question and a follow-up, and if there's more questions afterwards, we will go through them again. If you are on the Zoom or phone, please press star 9 or the raise hand function, and we'll start with reporters in the room.
Janet French from the CBC. David, you're using words like disarray, chaos, instability. What evidence do you have that the change of one leader would lead to that kind of disruption in frontline healthcare?
So we know we already have a fair amount of chaos in the healthcare system. They are still recovering from the COVID-19 pandemic. I know this because I get the texts every day from frontline doctors, folks that are in charge of acute care in major hospitals, from people that are in charge of surgery, about the continuing impacts they have seen from the decisions this government has made leading up until now. And this morning, my phone has started to blow up from hearing from those doctors about how shocked they are by this decision, how disheartened they are by this decision, and indeed using words like this is going to create chaos in healthcare. These folks are struggling to hold things together, even as now we may be entering a 6th wave. And for the government to leave Alberta Health Services leaderless, and to do so in a way that pretty clearly communicates that anybody that dares to stand up to this government can face the same treatment, that to me is a sure way to undermine the certainty and stability of our healthcare system.
Also in the news release, it said that the board has been searching for a replacement for Dr. Yiu for a number of months. What do you make of that remark?
Frankly, it doesn't surprise me. We have seen this government's, again, hostility to anyone that actually stands up for our public health care system. We saw that in spades under Minister Shandro. Minister Copping has certainly put a kinder face on it, but they've continued in the same kinds of behavior. So it doesn't surprise me that they've been working with the folks that they appointed to the AHS board to remove Dr. Yiu. But even if that is what they intended to do, and certainly as a government they have a right to do that, to do it in such a chaotic fashion with no replacement in place, with no system ready to go, indeed with not even having begun that process, I think just speaks to a crass political calculation on the behalf of this government as they enter into this Premier's leadership review. We've seen they've been willing to use every system and lever at their disposal to try to save Premier Kenney's political life. And it's just despicable to me that they would gamble like this with our public health care system for crass political gain.
Hi, Lisa Johnson from the Edmonton Journal. I just have one question. You use the word fired. Are you speculating, or do you have a specific reason to believe that she was fired?
I think the statement that was released by Minister Copping this morning makes it quite clear that it was their intent to replace Dr. Yiu. As was just noted by Janet, they've been working on this process, the minister says, for several months. So certainly I recognize that Dr. Yiu is a consummate professional, and certainly she is choosing her words carefully, as she has throughout this pandemic. But certainly I think we have seen what it looks like when somebody in a major public position like this chooses to leave the role. Certainly I think we see many more words said. They talk about, what they're looking forward to in the future, the other opportunities they might have. This does not look like, smell like Dr. Yiu decided that she was done. I think we've seen the behavior of this government throughout this pandemic. It has repeatedly been crassly political, wave after wave. And this looks to me like more of the same.
Catherine Gurkowski, Alberta Today. You said the UCP fired, and it's my understanding Alberta Health Services is an arm's length body that's governed by a board. Are you implying that there's some interference on the part of the government here?
I think we just have to look at the record. Let's look at just in the last month, when Minister Copping stood in the legislature and told me that he was waiting for a report from Dr. Yiu and AHS as to what they could do in terms of removing the vaccine mandate. He said that on a Monday afternoon, I believe it was. The next day, he stood at a press conference and said that he had ordered AHS to remove it. So let's be clear, this is a minister in a government that is not afraid of or above interfering in AHS directly. So certainly that is what I think happened in this case.
And there is an interim leader appointed, so they're not entirely leaderless. Do you have concern with who they appointed to be the interim leader, or is it just the
to be honest, this is breaking information. I haven't had a chance to learn anything about the individual who's been appointed as interim. Certainly, as I said, I have concerns about the direction this government is going to choose to go. They have shown they are not above directly interfering with AHS to try to force their agenda of forcing more private profit into our public health care system. And I will be watching closely to see who they choose to bring in.
Hi, Rachel Manuel with the Western Standard. We know COVID-19 is slightly on the rise, as shown through the data in the wastewater, and you yourself has just mentioned the potential sixth wave. I'm wondering if you think this removal is an indicator that the government has plans to go in a different direction with potential COVID-19 restrictions rather, should they be needed if the pandemic continues to be on the rise.
So certainly what we've seen has been the behavior of this government, particularly through the last few waves of COVID, is that they have put their political interests ahead of the public health. We saw that in August, where they went radio silent as the fourth wave built here in the province of Alberta. We could not get the Premier, we could not get the Health Minister, we could not get anyone on the record as hospitals were beginning to be overwhelmed as the ICU counts and the hospitalizations rose. And even when they came back, they sat on their hands for weeks before taking any serious public health measures, so that made that wave far worse than it had to be. As we went into the fifth wave, we saw them cave and give in very clearly to an extremist group who were illegally occupying the Coots border crossing, and suddenly escalate and accelerate their plans to lift health measures coming out of the fifth wave based on wanting to satisfy that extremist fraction of their own fringe, which of course we saw UCP MLAs going to support. So absolutely, I am deeply concerned that depending on what may be required in this sixth wave, that this government is not going to make decisions in the best interests of public health, but is going to continue, particularly with the Premier going through a leadership review, to put their political interests first.
Sure, and you've talked a lot about the negative aspects of this removal. Obviously, anytime someone leaves a role, there's now room for someone new to take that role, someone with a new vision. Do you think there's any way that the new individual could be improved? Is there anything that you would like to see being done differently with the new president when they're appointed?
So certainly I think there are robust processes available within the public service for the transition of these senior roles and certainly for hiring. But what we've also seen is that this government is not above interfering in those roles. For example, the decision of this government to appoint the former, I believe, president of the UCP as the public health advocate, the mental health advocate, where the Minister of Health, Tyler Shandro, actively interrupted the fair public process to personally force Ms. Harrington into that role. So this is not a government, and that was long before the Premier found himself in such dire political straits. So certainly I'm very concerned. So I think this process needs to be as open and transparent as possible, and this government needs to let the public service lead in terms of doing that fairly, the AHS board, and I'm certainly hoping that they are not going to continue to interfere.
All right, we'll now go over to the phones for questions. Dean Bennett, your line should be open.
Morning, David. So what I'm hearing from you then is that you're making a persuasive case that they interfered with Verna Yiu, but you have no knowledge or even secondhand knowledge that she was fired. I mean, it's quite possible that she decided that she didn't like the interference and she decided to leave of her own accord, right? Just wondering why you decided to take it that step further. Why do you make the case that she actually was demonstrably fired by this government when you have nothing to support it?
So, Dean, what we do have is a track record of years of how this Premier operates. Indeed, we just heard more news recently of how this premier conducted his own leadership review, how he bent every rule, perhaps broke some. We'll find out, I guess, when the RCMP releases their full investigation. But certainly, he is a man that has interfered, had his hands in the pot in every single situation to try to protect his own political benefit. That has continued since they were in government, and I've laid out many instances where that is the case. We saw their behavior through the third, the fourth, the fifth wave of COVID-19. We have seen the UCP MLAs that have been speaking out and calling for Dr. Verna Yiu's head, frankly. So, yes, no. Do I have a smoking gun? Do I have the email? No, I don't. But I have a pretty clear track record of how Jason Kenney and the UCP government choose to behave. And it's in a way that we know is well below the standard that is expected by most Albertans and indeed most parliamentary democracies.
Do you have a follow-up?
Yeah, perhaps. I mean, you have a smoking gun. No one's asking for a smoking gun, but something more than what it smells like to you, I think I would submit to you needs to be, it needs to be provided if you're going to make such a strong statement that someone actually has fired them. But my question then, David, is how much do you think this, it seemed like she was at odds with them over this vaccine mandate for health workers. How much do you think that played into the decision today to have her go?
So certainly I think that's probably the most public situation where we have seen that there has been clear daylight between Dr. Yiu and AHS and the UCP government, and indeed I'd say even resistance from AHS towards that government. But certainly I think this has been the case likely at many points throughout the pandemic. It has seemed pretty clear, that AHS has been wanting to take better steps to protect their staff, to protect the public, and the UCP continually is making decisions that undermine the public health. Now, again, we don't have a lot of that on the record because this is a government, of course, that has one of the lowest levels, I think, of transparency with the province, in all of Canada. But I think it's been pretty clear from the record that Dr. Yiu has been working very hard to help work through AHS to support Albertans' public health while this government has made that job more difficult at each and every turn.
All right, we'll go for another call of questions. If anyone on the phones would like another question, please use the raise hand function or *9 and make another call in the room.
So in the AHS news release, it does say that AHS is working to complete the transformations that you talked about, the changes to the continuing care, as an example. Whoever is hired, that's their marching orders, is to carry out the mandate of the government. If I guess this is a big if you're elected to government, would you have to go through the hiring process again, or do you think whoever they hired will do whatever job is asked, or what happens when it's their job to do what the government has laid out?
So it's a bit of a hypothetical. It's hard to say much until you actually see who the individuals are and what's accomplished and what's in place. What I will say is we've been very clear with the Alberta NDP caucus about what we would do should we have the opportunity to come into government. No government has done as much damage to our public health care system as Jason Kenney and the UCP. They have undermined it at every turn. They have driven doctors out of the province. They have fought with every other healthcare worker in the province of Alberta. They have damaged the capacity of our system and undermined it on every front. And it is our commitment that we will undo that damage, that we will build an actual collaborative relationship with physicians and healthcare workers in the province of Alberta, that we will make investments to build our capacity and bring stability back. So if the UCP government were to appoint somebody who did not share that goal and that agenda, well, I suppose we would need to consider whether or not we could continue to work with that individual. But again, that is a hypothetical, and we'll have to play the ball where it lies when the time comes.
All right, we'll make one last call for question. Dean, I see your hand is still up. Would you like another question?
Oh.
All right, and
Sorry, no, I'm good, thanks.
all right, and with that, we seeing no other questions, I will conclude our press conference for today. Thank you, everyone.
Thank you.
Tens of thousands of Albertans have already provided their idea for how we can build Alberta's future. You can too by going to albertasfuture.ca.